Welcome aboard the Spectrum Sphere, your gateway to a world brimming with knowledge and wonder. Today, we delve into the Black Death, a pandemic that reshaped Europe, and draw parallels with our modern-day COVID-19 crisis. Be sure to like, subscribe, and join us on this historical journey. Ready? Let's begin. The Black Death, also known as the bubonic plague, was a devastating pandemic that ravaged Europe in the mid-14th century. It's believed to have originated in Asia and spread along trade routes, reaching Europe in 1347, where it claimed the lives of millions, altering the course of history forever. Tracing back to its roots, the Black Death is thought to have originated in Central Asia or China, traveling along the Silk Road with merchant caravans. It eventually made its way to Crimea, and from there, via merchant ships, it arrived in Sicily and rapidly began its deadly journey through Europe. As the Black Death ravaged through Europe, its symptoms were unmistakable and devastating. It began with agonizing swellings called buboes, typically in the armpits and groin. Victims suffered from acute fever, chills, vomiting, diarrhea, and terrible aches and pains before succumbing, often within a week of the onset. The Black Death left an indelible mark on Europe, decimating nearly one-third of the continent's population. The scale of mortality was unprecedented, leading to social upheaval, labor shortages, and a collapse of the existing feudal order. This loss of life redefined demographic, economic, and cultural landscapes of the time. As the plague ravaged Europe, the drastic reduction in population shifted the dynamics of labor and economy. With fewer peasants, labor became more valuable, challenging feudal norms and leading to wage increases. This shift enabled some social mobility and weakened the grip of feudal lords on the economy and society at large. The Black Death's toll lessened the stranglehold of feudalism as depopulation resulted in labor scarcity. Surviving workers demanded higher wages, gaining leverage over landowners. This power shift led many serfs to leave manors for better prospects, contributing to the gradual dissolution of the feudal system across Europe. Confronted with the Black Death, the medieval medical community was largely powerless, reliant on rudimentary knowledge. Leeching, bloodletting, and herbal remedies proved ineffective against the rampant plague. Doctors, cloaked in beaked masks stuffed with aromatic items to ward off miasma, faced the pandemic with limited understanding and tools. As fear and desperation swept through Europe, society's reaction saw the emergence of scapegoats. Minority groups such as Jews, foreigners, and beggars faced persecution, wrongly accused of causing the plague. Many were subjected to violence and massacres, illustrating the dark side of human nature when confronted by unexplainable calamity. In the shadow of the Black Death, art and literature took a somber turn. Artists depicted scenes of macabre and mortality, evoking the pervasive sense of doom, while writers chronicled harrowing experiences and the fragility of life, forever imprinting the plague's terror on the tapestry of European culture. The psychological aftermath of the Black Death lingered long after the last outbreak faded. Survivors grappled with grief, loss, and the fear of recurrence. This collective trauma shaped societal behaviors, from heightened religiosity to hedonistic pursuits, as people sought meaning and solace in a post-plague world. As we consider modern pandemics, notably COVID-19, we find echoes of the past. The speed of global transmission mirrors the swift spread of the Black Death. Despite centuries apart, both eras reveal crucial lessons in public health responses, societal resilience, and the profound need for scientific understanding in crisis management. With the groundwork laid by the Black Death, let's pivot to our contemporary challenge, COVID-19. Emerging in late 2019, this modern pandemic has since had a grip on the world. The similarities in transmission and societal upheaval invite a comparison, underscoring the cyclical nature of our fight against infectious diseases. Transitioning to recent times, COVID-19 surfaced in 2019, much like the Black Death, from a zoonotic source. Fast forward several centuries, and we're still facing similar challenges: quick spread, devastating impact, and global change. Both pandemics serve as stark reminders of our ongoing vulnerability to diseases that leap from animals to humans. As COVID-19 rapidly spread across continents, it mirrored the pervasive reach of the Black Death. Societies globally grappled with unprecedented lockdowns, social distancing measures, and a newfound reliance on virtual connectivity. The virus's grip not only strained health systems, but also altered the very fabric of human interaction and community life. Healthcare systems faced enormous challenges during the COVID-19 pandemic. Hospitals were overwhelmed, critical supply shortages arose, and medical staff worked tirelessly under intense pressure. The situation echoed the scant resources and overwhelmed facilities during the Black Death, demonstrating that despite advances, healthcare systems can still be pushed to their limits. While the Black Death presented with high fevers, aching limbs, and gruesome buboes, COVID-19's hallmark has been respiratory distress, fever, and a loss of taste or smell. Despite centuries apart, both diseases have caused widespread mortality, disrupted societies, and tested the limits of healthcare and governmental response. The economic toll of COVID-19 is unmistakable, echoing the fiscal turmoil of the Black Death. Both pandemics slashed workforce populations, stifled trade, and triggered recessions. COVID-19, specifically, has led to unprecedented unemployment rates, a surge in government debt, and has forced a global reckoning on economic stability and resilience. As we grapple with COVID-19, technology emerges as a crucial ally. Innovations in telemedicine, real-time data analysis, and contact tracing apps have become weapons against the virus, a stark contrast to the Black Death era, where understanding and resources were sparse. Today, technology bridges gaps in healthcare and communication, fortifying our defense against pandemics. The pandemic has accelerated a seismic shift in labor and work environments. With COVID-19 constraints, remote work became the norm, transforming our approach to office culture and productivity. This shift echoes past societal changes post-Black Death, when labor dynamics were forever altered, underlining the profound impact pandemics have on work life. Living through a pandemic leaves indelible marks on society's psyche. The pervasive fear and uncertainty during COVID-19 have mirrored the dread once felt during the Black Death. Such events strain mental health and foster community resilience as we navigate the complexities of prolonged crises and the yearning for normalcy. Misinformation has played a pivotal role in both the Black Death and COVID-19 pandemics. During the Black Death, rampant myths about the disease's transmission and cures spread widely. Centuries later, despite advanced communication tools, false information about COVID-19 has significantly hindered global efforts to contain the virus and save lives. The COVID-19 pandemic has redefined geopolitics, heralding unprecedented international collaboration and, at times, tension between countries. Travel bans, vaccine diplomacy, and the push for greater self-reliance in supply chains have all underscored the delicate balance of interdependence and national interests on the world stage during times of crisis. In stark contrast to the Black Death era, medical science has made remarkable strides, particularly in vaccine development. Breakthrough mRNA technology enabled the swift creation of COVID-19 vaccines, highlighting a historic scientific achievement and offering a beacon of hope amidst the uncertainty of the pandemic. As the peak of COVID-19 recedes, society grapples with the new normal. This phase is marked by ongoing health precautions, increased remote work, and a surge in digital communications. Adaptations made during the pandemic have reshaped lifestyles and may continue to influence our daily routines well into the future. In managing a pandemic, government and public policy are pivotal. Effective leadership can greatly influence the course of a crisis. During COVID-19, travel restrictions, mask mandates, and social distancing guidelines showcased how policy decisions impact infection rates. Governments also play a crucial role in vaccine distribution and public health messaging. Despite being necessary to curb infection rates, lockdowns and restrictions during COVID-19 sparked varied public reactions. While some adhered willingly to mitigate the spread, others protested, viewing the measures as infringements on personal freedoms. This division highlighted the challenges of balancing public health with individual rights during a crisis. COVID-19 has undoubtedly accelerated long-term change across multiple sectors. Remote work has become a mainstay, with employers embracing flexibility. The healthcare sector is revolutionizing with telemedicine and digital prescriptions as new norms. Education, too, has transformed, with online learning platforms now integral to our pedagogical infrastructure. Understanding the Black Death's mayhem sheds light on our current pandemic strategies. Quarantines, social distancing, and the wearing of masks all stem from lessons learned centuries ago. Historical precedent guides governments and health organizations in their quest to curb transmission and save lives, reflecting a continuum of learning from past crises. The Black Death taught us that pandemics know no borders. Today, global cooperation is paramount. By sharing resources, information, and strategies, countries stand a better chance against diseases like COVID-19. This solidarity symbolizes our collective resilience and a united front in the ongoing battle against infectious diseases worldwide. As we've seen, pandemics leave a profound impact on society. Despite centuries between them, the Black Death and COVID-19 have exposed similar societal issues: healthcare weaknesses, economic strains, and social inequalities. It's a stark reminder that, though our world has advanced, some challenges persist through the ages. That wraps up our journey through the harrowing tales of the Black Death and its haunting echoes in the COVID-19 pandemic. Thank you for watching Spectrum Sphere. If you've enjoyed this voyage into history and its lessons, please hit the like and subscribe button for more diverse content every week.